Hi, today I'm going to speak about my experiences as a doctor in the healthcare of this country. As you all know, healthcare in America is a complex medical industry which has many stakeholders like doctors, hospitals, insurance companies, government, and regulators. Now, first I'm going to speak about the various stakeholders, then the problems that face our healthcare industry, and then some solutions to those problems. The first and the foremost stakeholder is the patient. Now, most patients want medical care, however, they don't directly pay for the medical care. Most money that's been paid out is paid by insurers. The second biggest stakeholder is the doctor. Now, most doctors want only to deal with the patients and not have to deal with the government or the stakeholders. But they don't have a choice and they have to deal with those stakeholders like payers, regulators, and pharmaceuticals. The third biggest stakeholder is the government, who not only pays for 50% of the healthcare, but also regulates doctors and hospitals and insurance companies and pharmaceuticals. The next is pharmaceuticals and insurers, whose main goal is to make money for the stakeholders and themselves and stay solvent. Now, the biggest problem that's facing healthcare today is that the pie through which money is spent out for caring our individuals is the same. However, the number of dependents are increasing day by day. People are living longer with chronic, complex medical problems. So they're living longer, not necessarily healthier. And this length of life, it comes at a cost. One study shows that Medicare spends more than 60% of the healthcare expenditure on people in the last 2 years of their lives. While on the other hand, there are people younger who work in Walmart and low-end jobs who can afford basic healthcare like going to a doctor or buying their insulin or the diabetic medications. Now, that's one problem. The second problem is government wants more and more control so they can control the expenditure and money spent on the healthcare. And recently, government, as you know, has passed the Affordable Care Act, which will ensure at least 10 to 15 more million Americans. This is a way to control the rising healthcare cost, at the same time put emphasis on quality. Now, the solution is we as a society have to figure out, what do we really want? Do we want quality of life or the quantity of life? If we choose the quantity of life, it will and should come at a cost. And then who's going to pay for the cost? Certainly government has their limitations. So either we all chip in or we start thinking about the quality of care and quality of life. And that's where the biggest focus though is. That's what government wants us to think about, is think about the quality of life and quality of healthcare, not necessarily quantity. So if all of us decide that we can settle for less, then we will have enough money, enough resources to go around, and especially have healthcare available for the needy and the young. And obviously, the elderly people will have to settle for less. So that's where the compromise and ethical debate comes on. So, well, obviously, this is not a solution, but this is at least a dialogue. This is where we all sit down, all the stakeholders have to come down and sit and talk about this difficult issue and find a solution. So even though we don't have a solution today, but as long as we have a will, we have a way out of these problems. Thank you.